In my 30 and almost 40 years now working in youth mental health, I'm entirely frustrated with the chaos that surrounds actually our willingness to develop new programs and new interventions. We all know there's a huge problem, but we're not going about it systematically. We're not developing a toolkit, a template, a transferable way of taking what works from one place to another, from one region to another, from one particular group who wishes to control their future to another who really wants to make a difference. This project has that capability. It will develop the tools, the structures, the learnings that will allow it to be transferred in Australia to those communities that want to make a difference. And importantly, from my perspective, to many other countries, to many other regions that similarly want to respond to the global challenge of youth mental health. One of the great thrills about developing this particular program has been the willingness of local communities through their local health organisations to stand up and say, I want to be part of this. I want to solve this problem in my particular region. I want to take a leadership role. From a brain and mind centre point of view, we're providing the technical tools, we're providing the background, we're providing the intellectual input to it, we're providing the support. But the real difference is partnership with local leadership to make a difference, to stop saying there's nothing we can do, to stop saying it's overwhelming, to stop saying we don't know what to do, but to saying if we work together and we do it smart for a change, we can make a really big difference. A critical aspect of this whole project is the input and the continuing dialogue with people with lived experience. This stuff has to reflect the reality that young people experience coming into care, their journey through care, where they receive benefits, where they're hurt by that care, where the decisions are being made that actually benefit them or not. You can get a certain amount of information from the numbers, but you need a lot of critical contextual information from those people who are using those systems. It's the validation, it's genuine, it's what's going on, what they are experiencing, what they're getting, what they're not getting, what is helping and what is not helping, who is helping and who is not helping, who says they help but they don't really, who says we've done a good job but the person says I don't think so, actually they didn't. Here's the critical flaws in either the modelling or in the implementation. So the role of lived experience is keeping it real, is keeping it genuine, is making sure that at the end of the day this is about better mental health care for young people in our communities. Phase 1 of Right Care, First Time, Where You Live is the planning exercise. Now the smart bit is using new dynamic systems models, things that come from engineering and from industry and finance and elsewhere. Create the system, recreate the system, and then understand how it works. Complex systems have complex interactions that you need to understand. So you don't cause more harm, but you also maximise good. To do that, you have to work with local communities. You have to get the local communities in that want to use such a model to determine what they do in the future. And you need to get them all in. In this case, young people who are going to use those models, those who provide services, not just in health, but in education and social welfare and surrounding services. Get them all in the same room. In our experience, they'll be talking to each other for the first time. Many won't have met. They'll all be doing their own thing and carrying on and saying, I just need more in my area. They won't have been looking across the corridor or across the street as to who else can actually help. Well, how can we work together? What can we bring together community-wise that will make the most effective system? Phase 1, in its workshops, brings those people together, puts the cards on the table, identifies the problems, then uses sophisticated mathematical techniques to create simulation models. So then you can ask, well, what if we invested in this particular program? What if we extended school-based education? What if we used new technologies? What if we set up a new clinic? What if we opened a new hospital? Would it help? Would it make a difference? Would it potentially make the situation worse? You can do a lot of things that make things worse while you're trying to do good. Do the things you put together simply go together, or they simply repeat each other while you completely ignore some other group that's not actually getting what it needs? It gets people in the room, it identifies the problems, it gets people to work on a common solution. That is the precursor to any effective action. So phase 1 is get it out there, organise it, agree what needs to be done, have strong mathematical foundations for decision making that will then empower the later phases of the program. We provide the tool, we encourage that set of leadership, then the challenge is to support people to take that model and start to use it in what they actually do. and then to look at what they need to support that. Things like digital technology, things like data systems, things like analytical systems, things like increased accountability, things like feedback from the users of the system. Are those decisions actually consistent with the model? Are they delivering better outcomes? Do they make sense? Or what else do we need to go and actually find to make the whole system work as we move into the implementation phases beyond the original modelling phase? So when we move from the modelling phase to the implementation, certain new things come into play. One of the really important aspects of this program that's quite unique is its use of technology. Digital technologies to coordinate care, to navigate, to create the tracks that trains can run on, the pathways that people can follow, and to collect data in real time about what is really happening to people's journeys. We do not do that currently. We have chaos, no information, we don't know. We're outcomes blind most of the time. So the digital technology phase which follows on is critical. Without information, you cannot reform systems. Imagine running power plants and electricity grids with no information coming back. In healthcare, we have information about activity, not outcomes. We don't know what's happening. We don't know who's disengaging. We don't know who's receiving care. We don't know which providers are really doing the best job. Information technology and data is critical to that. So the digital technology component of this program is critical to coordination, to data information, to accountability and tracking to see whether we're delivering better outcomes. At the Brain and Mind Centre, my colleagues and I have been working for several decades on developing the best model of clinical care for young people. We call it the Brain and Mind Centre Youth Model. How does that come together? How does more personalised assessment, how does learning about individual kids and their individual stages of development with the problems that they got translate into best initial assessment, best initial care, getting out of the problems they're in, preventing those problems coming back and recurring, getting on to productive lives? That's the Brain and Mind Centre Youth Model, how to do that best, particularly for common anxiety and mood disorders. We've got a knowledge about that at the individual level. What this project enabled us to do is to scale that. Not just take care of a few kids in the best possible way, but how would we do that for many, many tens of kids, thousands of kids in particular regions? That's what's the beauty of this project. What is really good at the individual level, scaled up to benefit many. One of the products that we've given rise to out of our work through the Brain and Mind Centre Youth Mental Health and Technology team over the last 2 decades is a platform for tracking individual mental health outcomes across a range of dimensions: symptoms, function, physical health, risk of harm, productivity. That's now encapsulated within the InnerWell platform for tracking, for empowering, for people to use, but also for healthcare providers to use to really know what is going on with young people as they move across the spectrum of care, as they have different needs at different times. Using that novel platform, that InnerWell platform that we have developed and evaluated here academically, is one of the essential tools to be rolled out in association with Right Care First Time Where You Live. You know, health's a fascinating thing. Many people in health go, well, health, well, that's hospitals. So why don't we build another one? Costs a fortune. It's good for the building industry. Doesn't it deliver better health? Often in mental health, no. It costs a lot to build a building, it costs a lot to maintain a building, it costs a lot to staff a building. It's often not what people actually need. Health economics allows you to say, well, what's the relative benefit of actually having more hospital beds, more hospitals versus different kinds of clinics, versus different healthcare teams, versus care that's coordinated long-term using technology, versus what do we do in schools, what do we do in families? You can look at these different things and say, what do they cost, for how long, what benefit do they deliver? Some things cost a lot and don't help a lot. Other things don't cost very much, but they do help a lot. We have to be transparent. We have to be open about the best buys. Which things, at what relative cost, deliver the most benefits? It's not always about getting the cheapest thing. It's about getting the best thing that delivers the most benefit and what is the realistic cost of delivering that benefit. Health economics allows us to look at what is the relative gain for dollars spent on particular services. What would we be better spending precious public money and private money on to get the best long-term outcome. That's a serious economic analysis. That's a serious economic benefit. And guess what? It makes an important difference to governments, to families, to others to choose to be involved in this area. We need to show which of the things we're talking about are really strong economic value along with their social and health value. That helps to make better decisions and people to invest in this area in the long term. One of the unique aspects of Right Care First Time Where You Live is we're rolling it out in 8 different parts of Australia. Inner cities, outer urban, regional and rural and remote, including some specific projects with Aboriginal and First Nations peoples. This allows us to look at what is happening that is common across all of those areas. Are there elements that apply no matter where you're operating? Versus are there elements that are quite specific to place, to learn what needs to be done in general that is transferable from one area to another, but what is quite specific to different groups, to different cultural groups, to different geographical places, to different settings in which healthcare is delivered. Because we have that capacity to look across all 8 sites, and hopefully in the future more than 8 sites, we'll be able to make those comparisons, learn what is generally true, but also what is site-specific. What do you need to know if you're going to take this program, which is absolutely our intention, to other places in Australia and internationally? Learn by comparison across those different sites. I actually think we've got a solution here. I actually seriously think if people took up this program in regions of Australia and then internationally, these problems would be tractable. We could solve problems. We've got to do things differently. What I love about this program is it's different. If we succeed here, we will transform the way youth mental health care is delivered in every region in which it's operative, focusing on better outcomes for young people and their families and better outcomes for us as a society as a whole.